Hypertension or high blood pressure is a condition where a person's blood pressure reaches 140/90ths of a millimeter of mercury or more. Hypertension is also known as the silent killer. If not treated, hypertension can cause a compilation of other serious diseases, including heart failure, kidney disease, stroke, or even can lead to death. Old people are more at risk of getting hypertension. When over 65 years old, people's blood pressure can increase as the arteries stiffen and narrow due to plaque buildup. Women can also develop high blood pressure during pregnancy. Apart from that, this disorder can also occur in children, usually caused by kidney or heart disease. What you consume can also affect your blood pressure. High blood pressure usually does not show significant symptoms. There may be several health problems that are considered normal, but it was symptoms of high blood pressure. Blood pressure will be high if the pressure of blood circulation on the walls of the body's arteries, which are the main blood vessels, is too high than normal pressure. People will experience several symptoms such as severe headache, nosebleeds, vision problems, chest pain, ears ringing, out of breath, and arrhythmia. That is mild symptoms of high blood pressure. In severe high blood pressure, the symptoms include fatigue, nausea or vomiting, confusion, feeling anxious, pain in the chest, muscle tremors, and the presence of blood in the urine. If you experience one or more of these symptoms, check with your doctor to make sure it is a symptom of high blood pressure or another disease. A person has high blood pressure in two ways. The first is developing slowly through a long process. This is called primary hypertension. The risks are related to age, diet, having a sedentary lifestyle, and other habits. The second cause is due to certain health conditions such as obstructive sleep apnea, OSA, kidney problems, adrenal gland tumor, thyroid problems, trunk defects in blood vessels, medications, such as birth control pills, cold medicines, decongestants, and over-the-counter painkillers. Illegal drugs. It is classified as secondary hypertension. But, can hypertension be cured? Unfortunately, hypertension cannot be cured. Many experts say that hypertension is a permanent condition. If blood pressure returns to normal, it does not mean that a person has completely recovered from hypertension. They still have the potential for diseases caused by hypertension. If it is not managed, the blood pressure will recur. If your high blood pressure is caused by another underlying disease, the hypertension you experience can be treated by treating the cause, if the underlying disease is possible to cure. However, for people with essential or primary hypertension, this condition generally cannot be cured, but can only be controlled. We may not be able to avoid some causes of high blood pressure, such as aging, biological sex, a family history of high blood pressure, and diabetes. But we can overcome other causes. These are the risk factors for hypertension that we need to be aware of. Frequently consume foods high in excessive salt. Overweight or obesity. Family history of the same medical condition. Consuming less fruit and vegetables. Lack of exercise or physical activity. Consuming too much food or drinks that contain caffeine. Have a smoking habit. Consume a lot of alcoholic drinks. Stress. High levels of stress can temporarily increase blood pressure. Experience certain chronic conditions, such as kidney disease, diabetes, or sleep apnea. The first-line treatment for hypertension is a rearrange in lifestyle. This effort can be done with regular physical exercise at least 5 days every week. Stress reduction. Avoiding or learning to manage stress can be done with a few relaxation techniques such as meditation, warm baths, or yoga. Intensive treatment is something that needs to be done for those who have already had a stroke. Doctors often recommend lower doses initially. Ultimately, people with hypertension may need to combine 2 or more medications to regulate their blood pressure. A person who undergoes routine therapy and has good self-control is proven to be able to live a normal life without significant health complaints anymore.